Welcome to Catalista's The Beautiful Work Challenge, coming to you from the temple at Catalista Centrale. My name is Fiona Watt. The Beautiful Work Challenge is an audio kaleidoscope that illuminates the essence, the current situation, and the potential transformation of the world's professions. It all boils down to, what's the good of our work? This is On Birth, the essence.
If you think about the coming in journey, it's a massive, epic journey, probably the biggest one we'll ever make into life and into the body.
In the Mahayana Buddhist tradition, it's understood that ideally, male and female energies should come into balance in a warm, compassionate, loving, tranquil environment in a gentle way, with mindfulness. It is important that the mind-body not be split. Neither the mind engaged in fantasies, nor the body engaged in aggressiveness. The quality of compassion and kindness needs to permeate the mind-body to create a good environment for the child to enter. Chapter 1. Conscious conception and the consciousness of the baby.
I would say my recommendation for conscious conception is that you would begin to work with being conscious about the conception of your child a minimum of 9 months before you plan to conceive. Or say roughly about a year, but you could say 9 months. And that during that time, you would look at how you came in, both parents. So that would be what was going on between your parents when you were conceived. What kind of relationship did they have? What was the state of play in their relationship? What was their life circumstances together with each other? And what kind of sex were they having, in a way? Which is, if you think about conception, it's our first hit of sexuality as an imprint. So that's a really big part of conception, because we all come from the sexual act, right?
Karen Melton is a somatic hypnotherapist who specializes in prenatal and perinatal psychology and health. She works therapeutically with babies in the womb, expectant mothers, and families with newborns.
So what was going on there? Were they drunk? Were they connected? What was happening? What kind of intimacy and connection did they really have? So that's that part. And then just how was your journey coming in? What's your journey as a parent? Because that's so crucial, because what a lot of people don't know, and what's very unconscious in the culture, is that we repeat our own journey unconsciously. So the moment that an adult thinks about conception, I think I'll have a baby, I'm going to decide to have a baby, they are actually often reliving their own preconception dynamics, and then their conception dynamics, and then as you move through the pregnancy, once they get pregnant, if something happened to them in the first trimester, they'll relive it in some way. And that's not really necessary if it was a difficult thing.
I would say the number one discovery really is that for a long time, it was assumed by scientists, obstetricians, pediatricians, the whole array of scientists involved in psychology and psychiatry and gynecology and obstetrics. It was assumed that the unborn child was more or less like a little goldfish swimming around in a bowl of water, the amniotic fluid, and that it was really an insensate kind of a being, and nobody paid much attention to the possibility even that there might be some degree of consciousness before birth.
Thomas Verney is a psychiatrist, writer, and academic who specializes in the psychology of pregnancy and birth. In 1983, he founded APA, the Association for Pre- and Perinatal Psychology and Health. He is the author, with John Kelly, of The Secret Life of the Unborn Child. His most recent book is The Embodied Mind, Understanding the Mysteries of Cellular Memory, Consciousness, and Our Bodies.
What I proposed in that book, The Secret Life of the Unborn Child, and have backed up with many, many, many studies, is the fact that certainly from the 6 months after conception, In other words, at the end of the second trimester, the unborn child really is a sensing, feeling, sensate, and remembering little human being. Obviously, in a very primitive way, but nonetheless much more psychologically developed than we have ever given him or her credit for. So if that is true, and I believe, and there's a great deal of research to show that that is true, then certainly we need to relate to that unborn child in a much different way than we used to when we thought that it was a non-sensate, non-intelligent, just little organism like the stomach or the pancreas or something like that. So that means that both parents and caregivers have to relate to that child as if it was already a very tiny little human being instead of just a blob of protoplasm. So that's number one.
David Chamberlain was a psychologist, editor, and author who wrote The Mind of Your Newborn Baby and Windows to the Womb, revealing the whole baby from conception to birth. David served as president of APA for 8 years.
Our way of thinking about babies has been pretty materialistic. That is, it's been based on anatomy, on matter, specifically brain matter. And we judged people or babies by the amount of brain matter that they had. And we made the presumption that unless they had a lot of brain matter, and particularly the kind of brain matter that comes at the end, the cortex, the full development of the cortex, we thought they would not be capable of any sophisticated mental processes, including memory and learning. Virtually everything that we know now of a scientific nature has come to us only in the last couple of decades. It's all new. And it turns out, if you look at what we have thought about infants, we've been very prejudiced. All kinds of myths about them, from being animals or subhumans and not quite like us, to being blind and deaf and dumb and not feeling anything, and their cries are worthless and their smiles are meaningless. All these things turn out to be just myths. We have facts today to look at to show us how really intelligent infants are. If you study spectrographs, which are very elaborate portraits of sound, taken from the first cry of a baby at about 900 grams, a baby that might be 25 or 6 weeks in gestation. If you take a portrait of the first cry, that spectrograph can be matched with its own mother's voice, which means that already by about 25 weeks, that baby has listened to its mother's voice long enough and intelligently enough that it has already learned many of the speech characteristics of that particular mother.
Psychiatrist and founder of APA, Thomas Verney.
So like at the end of the second trimester, so after 6 months, okay, you can do, for example, electroencephalograms, EEGs, brainwave studies of unborn children. And you can already detect REM sleep, rapid eye movement sleep. Rapid eye movement sleep in adults, you and I, almost always shows that you are dreaming. So if that child is dreaming, then that means that already there is some degree of cognition going on in the brain, which is a sure sign that the brain is actually processing information.
Somatic hypnotherapist Karen Melton.
So that's the next thing is I ask parents to look at. Let's look at what might get in the way of you having the kind of pregnancy and birthing experience that you want to have. And let's look at how we can create the optimal environment for your baby. And of course, the central thing in all of that is your baby is conscious and sentient. Your baby is involved in everything that's going on, is responding to everything that's going on, and is having his or her own experience of what is going on. So as soon as you even conceive of having a baby, you're moving into a relationship in a sense with that being. And then as you come more in, it becomes more embodied and connected. And then a lot of conscious conception is really about building that relationship consciously. So including the baby, thinking about the baby in everything, because you're already a parent. from conception. You're not a parent when your baby appears on the outside because they've been with you for 9 months already. So that's kind of like our cultural idea of, oh, I'm not a parent until my baby's born. But you are. You're a parent right from conception, if not before. So that's the idea. And central in all of that is, as I said, it's consciousness. We are so conscious. And we can have an enormous effect on our babies and how they're coming in. Absolutely off the charts, huge. If we bring that information into how we're doing it.
In our society, we have gone to the point where we are focusing so much on what I call the physical and intellectual aspects, which have to do with the patriarchy. Therefore, have lost the part that has to do with our feminine, female energy and power. And so recapturing that is something that can only be done by completely understanding the conscious baby and connecting and bonding with the unborn child. And when that happens, the conscious baby can do a great deal to help transform this whole thing.
Sandra Bardsley has worked as a labour and delivery nurse, midwife, doula and doula trainer, lactation consultant, childbirth and parenting educator and counsellor. She also served as president of APA, whose membership includes psychologists, physicians, sociologists, nurses, midwives, and doulas.
You want to wake people up to the fact that the prenate is completely conscious and sentient, able to take in and does take in, am I coming to a world that will be supportive and loving, or do I need to be on guard all the time?
What's the difference between a doula and a midwife? A doula is a trained professional who provides continuous physical, emotional, and informational support to a mother before, during, and shortly after childbirth to help her achieve the healthiest, most satisfying experience possible. Midwives are the keepers of making birth safe, making sure that the mother's health and well-being is being monitored through pregnancy, through birth, and into early parenting. Chapter 2. Care for the woman.
Midwife and doula trainer Sandra Bardsley.
So the way we take care of the mother is the thing that's going to be important. In a lot of traditional cultures of ancient wisdom of the world, when a woman becomes pregnant, she is treated very carefully and not allowed to be around negative things, fighting.
I see this sometimes in more indigenous cultures, that there's a belief that pregnant women, like if there was a tragedy in the world, like they shouldn't see the news. Or sometimes even if there's like a death, unless it's really immediate family, they shouldn't be notified.
Debra Pascali-Bonaro is a doula trainer, Lamaze childbirth educator, author and the director of the documentary Orgasmic Birth, the best kept childbirth secret. She is the current chair of the International Mother-Baby Childbirth Initiative, a global initiative that provides guidance and support for safe and respectful maternity care.
So there's this sense that you want to keep pregnant women surrounded almost in a bubble of support, love, and happiness. And that always really touched me when I see that in places around the world, because I feel like we've lost our sense of community in many places in the US. And certainly with technology and news, pregnant women are sometimes so exposed to all that's going on and can take in the stress of it. And we have new data that actually shows that when the mother's stress levels rise, she's actually setting the stress system for her baby. And so we now know that cultures like in Bali there, where they're doing everything to bring pregnant women together and kind of give them both health with many modalities, but also wellness and emotional sense too, actually makes good sense with science. And I wonder how many of our ills sometimes in America are because pregnant women are so stressed. And we're then setting the next generation on a high stress mode. And that would make sense that babies need to come out prepared to welcome the world around them.
Phyllis Klaus teaches and practices therapy, hypnotherapy, and counseling to individuals, children, couples, families, and groups. She has been working with the concerns surrounding the perinatal period for over 40 years. She is a founder of Dona International and is co-author of Mothering the Mother, the Doula book, Bonding, and When Survivors Give Birth.
Working in a hospital, of course, I saw a lot of people with symptoms of pregnancy. The severe vomiting called hyperemesis gravidarum, irritable uterus, premature labor, and such things. And many times these have an emotional component to them, and they can be alleviated or stopped or certainly reduced. What I do is I have people just kind of drift into a relaxed state and communicate with their inner wise mind and see what the meaning of the symptom might be. And it's individual for every woman. Let's say the hyperemesis, which is the vomiting, which is so uncomfortable, the nausea. And I've had about 65 clients. And in each case, we've discovered the underlying fear or anxiety or situation and been able to stop it. And there's a lot of old wives' tales that unless the woman at the well in the community is looking unwell and all the other women are saying, well, I bet she's pregnant. So it became sort of a message, unconscious, to show everybody that you were pregnant. And once several women have kind of recognized, oh my gosh, I think that's what it's about. And I said, would it be okay to stop the symptom now and find another way to show the importance of this state now and this stage of your life? And all of them have said yes. And now today with ultrasound, we can also say, isn't it wonderful to know I'm pregnant and I don't have to be sick to prove that?
Karen Melton.
Well, the environment is the mom, really. I mean, that's the main environment. And then there's the relationship environment. And then there's the inner circle of the couple. And then there's the outer circle of the couple. And then there's where they live. And then there's, so there's various layers in the environment. But the major environment is the mom and the other parent. And so if you think of the mom as the environment, it's incredibly impactful. It's all incredibly impactful. But mom is the closest one in. Yeah, profoundly. And how we treat mums and how we support mums and how their partner's treating them and all of those things. Very impactful indeed.
Therapist and author, Phyllis Klaus.
There's so many important changes that occur during pregnancy. We need to think of parenthood or pregnancy as an amazing transitional and developmental phase in a person's life. There's the normal transitional issues that parents face. And then there's the psychological and emotional aspects they need to deal with. So whether the pregnancy was planned or unplanned, you need to help the parents look at how they're really feeling about this. And what does it mean being pregnant now? How is it affecting their lives? And how does it affect their relationship? For women, this is so important because she must have some grounding of feel supported. I can tell you that feelings and distress, whether it's traumatic, past, or loss, or grief, that the disorders of anxiety and depression are often what we call a disorder of memory. The memories of things that people have gone through that they've never had a chance to explore or express. And they can do it in a very kind, thoughtful way without having to solve it. You can't solve the loss, but you can solve the pain that people live with that they've never had a chance to share. Just having another hand that says, I care about you and sorry you went through that. And to be able to have that is so valuable.
The author of Orgasmic Birth, Debra Pascali-Bonaro.
We know that the baby is hearing from 34 weeks on. They're listening, they're feeling, they're literally bathed in the mother's hormones. They're drinking them in utero. So when a mother is in a stressful state in labor and birth, the baby is also put in that state. When a mother is in a calmer, feeling loved and respected and honored, that's a completely different feeling for that baby. So I think that what we need to know is that birth is whole and healthy, and that we have an opportunity to look at ourselves and find the pieces that need healing, to find the knowledge about birth so that we feel calm and confident, and to surround ourselves with people that not only love and respect us, but also hold a solid belief that birth is normal and natural. And all of these elements are huge amongst themselves, and they are really, I think, the journey of pregnancy is to take the time to do that.
You, who were darkness, warmed my flesh. Where out of darkness rose the seed. Then, all a world I made in me. All the world you hear and see hung upon my dreaming blood. There moved the multitudinous stars, and coloured birds and fishes moved. There swam the sliding continents. All time lay rolled in me, and sense, and love that knew not its beloved. O node and focus of the world, I hold you deep within, that well you shall escape and not escape, that mirrors still your sleeping shape, that nurtures still your crescent cell. I wither, and you break from me, yet though you dance in living light, I am the earth, I am the root, I am the stem that fed the fruit, the link that joins you to the night. Woman to Child by Judith Wright. Chapter 3, The Baby Mother Dyad.
Thomas Verney.
I think the two most important discoveries about prenatal life, that the unborn child is just a lot smarter than we have given him credit for. And secondly, that the mother's state of mind and state of health has a tremendous influence on the developing brain and immune system of her child.
Doula and educator, Debra Pascali-Bonaro.
Our emotional state has a profound effect on our birth, as it does in life. We all know on days when we are either in a state of more joy or pleasure or love, and when we're in a state of fear or distress, or in some cases trauma, that our body has a very different feeling. The baby's stress system really gets set at the level of the mother. So when they're born, they feel they're okay in their surroundings, because if they're coming into high stress, then their stress system has to be set high enough that they can be comfortable in it. But the problem with that is resetting your stress system is much harder to do, not impossible, but we're seeing quite hard to do, rather than being born into a very peaceful, calm environment where your stress system is set lower, then it's going to set that lower for your lifetime. I think we're at the tip of the iceberg in really proving how maternal stress then sets our system and goes out many years later. But it makes a lot of sense. Now we can show that it does affect the baby's level when it's born. I would suspect that this has a much stronger lifelong influence than we've ever considered.
One of the things that I really encourage parents to do is to talk to the baby prenatally and, of course, postnatally, but especially prenatally. And also you can do a lot of other things with the baby. You can play music to the baby. You can sing to the baby. You can play with the baby. A lot of women have described to me how they can sort of push in with one finger into their abdomen on one side, then they push in on the other side, and within a few seconds, the baby picks up the game, so to speak, and starts pushing with its tiny little hands against the mother's fingers. women tell me that this is the most amazing experience. So these are all the kinds of things that one can do. But what one should not do, and this is, I think, is important, because a lot of people think that if you do something that is good, you should do more of it. The one thing you should not do is try to overcome the baby with too much noise. Like, for example, some people thought that because I advocated playing classical music to babies in my first book, The Secret Life of the Unborn Child, because I advocated playing Mozart and classical music, they would play classical music all the time. Now, the baby needs its sleep. So only try to communicate with your baby when he or she is awake. Don't try to, make it impossible for that child to go to sleep because he or she needs that sleep.
So I do think that both our mother, baby, both as a dyad, are sustaining trauma. And we're just beginning to understand how some of our patterns in life, some of our triggers, some of our lifelong issues, our inability to connect, and certainly the world right now cannot sustain any more people that don't have love, caring, and compassion. And I do believe that a lot of these things are what birth is intended to bring to us. And when we disconnect, when we disturb, when we separate mother-baby and don't have these bonds, we are human and we can really work to overcome this.
Epigenetics is a gift to prenatal psychology. What epigenetics has taught us that genes can be turned on and turned off by environmental factors. So stress, for example, turns genes on or off depending on what state those genes are in. So the environment does not change the genes themselves. What it changes is their expression. So it's like you have electricity in your house and you enter a room and it's dark. Well, you turn the switch on and suddenly it's light. That's what epigenetics does. It turns the switches on or off. So you may have genes for cancer, but they are silent. They are not turned on. They are just sitting there waiting. And if there is pollution in the air, or if there is too much stress, plus all the other environmental factors that may or may not affect the gene, then that switch may be turned on, and then you get cancer. But the other thing that's very important is that there's no one gene that is responsible for anything. You always need a whole group of genes. And playing with genes, as a lot of geneticists are considering doing, is really a very dangerous exercise, because the gene that may perhaps put you at risk for cancer may also be the gene that with 79 other genes gives you a high probability of developing a musical talent, for example. So it's incredibly, incredibly complicated, and we have not even come close to understanding genetics. But the one thing, in terms of the birth psychology that we are discussing, the one thing that we know for sure is that factors like stress, anxiety, depression, they all have a negative effect on genes, and they turn on genes which are not healthy for you. And one of the things that I would really like to emphasize is that, again, people don't know about. During intrauterine life, every second of intrauterine life, you have 50,000 new neurons being produced. 50,000. So you can see that because there's so many brand new neurons, and the newer a cell is, the more vulnerable it is. So these vulnerable cells can very easily be destroyed by too much stress, or pollutants in the air, or nicotine that the mother might be smoking, or alcohol, or heroin, or cocaine. Any of those substances are potentially destructive to neurons. So what happens is that a lot of the neurons that are potentially going to be in the brain are destroyed, or that some of the configuration of neurons is influenced. So that a child of a mother who is under chronic stress, then that child is actually born with a dysfunctional brain. So what we are dealing here with is already a child whose hardware is already not in best shape. So naturally, if your brain is already not working optimally, you are going to have more behavior problems, more cognitive problems, more emotional problems. All of those things are more likely.
Sandra Bardsley.
Even issues such as the increased amount of autism, the increased amount of ADD, and other psychological issues that have to do with the nervous system. I don't think it's all one thing, but I do think that how we prepare for birth and how we treat the mother and conscious baby has a great impact on how these things play out.
When I studied medicine many years ago, we were taught that once you're born, this is all the neurons that you will ever have. And after that, it's downhill. Today, we know that actually neurogenesis, in other words, the birth, the production of new neurons, happens all the time. For example, in the amygdala, which is a part of the brain where all the new information comes in from the outside world, in the amygdala, you have 10,000 new neurons being produced every day. So, in a positive, helpful, supportive environment, loving parents, a lot of reparative work can be done. It's impossible to say whether you can totally repair it, but certainly a lot of it can be repaired.
Sandra Bardsley.
One of the beautiful statements that's being made by Suzanne Arms, who is a great activist in this field, she says, if we hope to create a nonviolent world where respect and kindness replace fear and hatred, we must begin with how we treat each other at the beginning of life, for that is where our deepest patterns are set. From these roots grow fear and alienation, or love and trust.
Have you seen the movie Monty Python's The Meaning of Life? There's a sketch called The Miracle of Birth. 2 doctors are flipping cards into a waste paper basket. Good shot. When a nurse rushes in. The patient's contractions are more frequent, doctor. The doctor instructs the nurse to move the patient into the fetus frightening room. Entering an empty operating room, the doctors comment on how barren it feels. The first doctor instructs the nurse that more apparatus is needed. Bring in the MRI, the EFM, the PET, and the CAT. And don't forget the machine that goes. Once impressive equipment fill the room, the 2 doctors have a sense there's something missing. Says the first doctor. Says the second. Patient! The nurse finds the woman on a gurney behind a bank of machinery. The doctor says to bring it over here. And don't scuff the technology. Sorry, doctor. The doctors welcome the patient and assure her that they'll soon have her cured.
We'll take care of everything. Start the drip. Monitor the monitor. The moment the baby comes out, can I cut the cord? Only if I can do the episiotomy. Perfect. Legs up.
Chapter 4. Labour and Birth. Robbie Davis Floyd is a medical and cultural anthropologist, researcher and author known for her research on childbirth and obstetrics. She is the author of Birth as an American Rite of Passage, Birth Models That Work, Mainstreaming Midwives, and other wonderful books.
As far as I know, there is no what you could call universal value that women hold in birth beyond the fact that everyone wants a healthy baby. Every woman wants to live and she wants the baby to live and be healthy. On top of that, every woman wants to be treated during birth with respect and dignity. Beyond that, women want lots of different things in birth. Some women want to catch their own baby. Some women want totally natural childbirths in a cabin in the woods. Some women want to schedule their cesarean. We are not a unilateral group. Women are totally diverse. So what we want in birth is not universal, except for the fact that nobody wants to be treated with disrespect or violence. Obstetric violence has become a huge problem. Well, it's always been a problem, but it's now been identified and named. In the last 5 years, we've given it a name, obstetric violence. Now we talk about human rights in childbirth, which is something we never used to talk about, that we realize that women have rights in childbirth to be treated respectfully and with dignity, and to have their choices and decisions respected, and to be given the information that they need to make informed choices. And those are human rights.
Debra Pascali-Bonaro.
And so when we're in labor, our surroundings, who's with us, and how we feel will completely transform a birth into being gentle and a memory that we'll look back with love, or too stressful and a memory that sadly too many people can look back with sadness or disappointment or suffering birth trauma. As a doula, I've had an opportunity to attend hundreds of births, and I kept noticing that there was moments of joy, laughter. We would dance or sing in between kind of some of the sensations, that we could bring a new language. And yet all that I saw out in the public was talk about pain and fear and tension and fear. And kind of it was escalating in this negative sense that birth was an emergency waiting to happen. And my experience was great joy and pleasure, and what I've come to call orgasmic birth.
Ina May Gaskin is founder and director of the Farm Midwifery Center, located near Summertown, Tennessee. Ms. Gaskin has attended more than 1,200 births. She's the author of Spiritual Midwifery, Ina May's Guide to Childbirth, and has lectured all around the world.
We don't want adrenaline to be the hormone that's happening in the laboring mother. And so how do we make that go away? We want the calm hormone, which is oxytocin, and it doesn't just come in little vials. It's actually produced by the body itself, but not when the mother is in a state of fear and anxiety. It happens when there's somebody who's reducing her fears, who's actually helping her laugh, or to breathe deeply, or to move into a position where she feels better. Her body's producing the hormones that make her calm, that actually make her labor progress without having the oxytocin from another species synthesized coming into her arm via the IV. And it actually produces states of mind at the same time. It makes the uterine contractions go well that get her euphoric, that cause her to go into an ecstatic state. When you have an ecstatic state, it helps the baby's heart rate. And then when birth happens, you get fewer perineal injuries. You get a baby in better condition, less likely to be stressed and having a hard time breathing.
Debra, I think we've sanitized birth, almost sterilized it to the point that we've removed the pleasure. And not only is that depriving us of an experience that's life-affirming and life-changing, but it's also taking away opportunities to find comfort. We're literally being put down and put into beds that make labor longer and increase pain. So I love to talk about all the many ways that we can find comfort and bring more love and care to birth. Birth is a part of our sexual life, and this is a piece that often gets overlooked. I think part of the sterilization of birth that we've done in hospitals to put people down and in gowns is to strip the sexuality of birth away. But you have to look at birth as taking place deep in women's intimate spaces, in places that we often associate with sexuality. And if our sexuality has been whole and healthy, and we can honor this part of birth, birth often can be easier. But for those that are survivors of sexual abuse, pregnancy is a time to look deeper into healing, because birth can be incredibly healing for survivors, or sadly, too many people can be re-triggered or re-traumatized. Birth is physical, emotional, spiritual, and sexual, and we need to align all of those elements to have the safest and the gentlest birth.
Somatic hypnotherapist Karen Melton.
Wow. I would say what every woman should know about birth is that long before she gets there, she needs to get in touch with her own body, her own instincts, and her own empowerment in whatever way she can, and put her baby in the center and be, as conscious about it as possible. Because by the time she gets there, she doesn't have any of that. And she's going to go in a hospital, which I think in America, 99% of women do. It's hard because you get taken over in there quite often. And their whole thing is imposed on you. And if you're not strong and your own center, and you don't have your own sense of your own instincts about what's going on and your own intuition and know your own body, it's much, much harder. And I see many women, that's another group I work with, women who've had a very traumatic birthing experiences, usually in hospitals. And they are devastated, they're traumatized, and they completely lost their birthing dream as well. And that's a huge one for women.
Cultural anthropologist Robbie Davis Floyd.
When I was giving birth to my daughter in 1979, we didn't have a lot. We had Thank You, Dr. Lamaze. We had this wonderful book called Common Sense Childbirth. And a friend gave it to me, and I read it, and it made total sense to me. And I decided I wanted a natural birth. So I picked an obstetrician who was renowned for being holistic and patient and into natural childbirth. And he was killed in a car wreck 2 months before my baby was born. And so I was shuffled out to his partner, who was very medicalized. Whereas my friend, he had managed to find this other doctor that I didn't know about, who was more patient and more holistic, and who would allow her to labor for 36 hours. Most hospitals don't let you labor for that long. My first birth was a cesarean for failure to progress and cephalopelvic disproportion, meaning the baby was too big to get through my pelvis. And then I gave birth to a 10-pound baby at home. So obviously my pelvis was fine. It took me months to figure out why I'd had the cesarean and realized that I'd been screwed by the medical establishment. I did what all anthropologists do. After my birth experience, I was so confused about why. Again, that question, why had I ended up with a cesarean when my friends who went into labor on the same day as I did had a totally normal birth after 36 hours of labor, that I was given a cesarean after 26 hours of labor. In all my research, I've come to conclude that what is really the most important determinant of your birth outcome is the paradigm of the practitioner. So her practitioner had a holistic, naturalistic, humanistic paradigm. And so she got the birth she wanted. And my practitioner had what I now call a technocratic paradigm. So I got the birth that he wanted.
Karen Melton.
So there has to be a kind of a combination of being in the center and feeling that's strong in that, and also having that ability to just be in the unknown, because that's what birth is in a sense. It's a deep, deep, deep letting go into the unknown and the mystery. Many women can't do that. And the hospitals, I know they try, but they don't create a deeply restful environment for birthing mothers. It's bright lights, there's all sorts of people in and out of the room. They're pushing you to do this and pushing you to do that. If you don't do this, this is going to happen, or, all this stuff is going on. And I think it's just not meeting the instinctual needs of women and babies at birth. And it makes it very stressful. It's challenging, birthing is challenging enough without having to deal with all of that being imposed on you.
Midwife and author Ina May Gaskin.
All laboring mammals are going to be typically moving in labor. Why? Because they're obeying the body signals that want them to move. I think we in the US are actually very superstitious about birth. We're, in fact, superstitious about the use of technology, and in the sense that we think technology is better than nature. While we can do some high-tech things that improve eyesight, or we've got technology about the heart, and you've got people with triple and quadruple bypasses, and it makes us think that you can do things to the uterus and the vagina that, in fact, you can't do. Sorry, we can't improve on nature there. We actually have to consider some laws of nature and birth And I'd say one of the big laws is that you don't harass or make a laboring mother uncomfortable, because this can actually cause complications. We don't usually think of that, We think, oh, nature always goes wrong. Nature doesn't always go wrong, or I wouldn't be sitting here today. Because before I became a midwife, I had never seen a birth, but I knew that birth could happen because I was a farmer's daughter. And even though I'd never seen it, I knew it happened with all the other species. And I didn't happen to think that the human species was inferior to the other mammalian species.
Karen.
I think also the thing about birth is it's great to make the plan and be conscious and aware and think about all the different things you want and don't want. And then you have to have the ability to let go into it and be in the flow, because you don't actually know what's going to happen. You know you're going to have a baby, but you don't know what that journey is going to be for you and what the journey is going to be for your baby.
Debra.
Historically, birth was very feminine. It was the circle of women that supported the laboring woman, and the male, the father, was often present, but not the intimate circle of support. They were the protector, kind of the keeper of the area. And this is even true in animals, like in elephants. It's the bull that protects, that no one disturbs the process, and it's the intimate circle of females that actually provide the comfort and are there for the birth. One thing I do know is that fear is contagious. And if I have a father who's terrified of birth, sometimes just like saying, I'm going to be there no matter what, because, we made this baby together and it's my role to birth it, doesn't always make birth easier, because any fear in the room will hold birth back. And sometimes I'll help that father to run some errands and do some things that are needed. And their participating from a distance actually makes labor go easier. And then they come back. Obviously, for the moment of birth, I would never want them to miss being there to welcome their baby. So I think how they interact in labor is really up to the couple and both of their relationships and their sense of safety and trust of birth to be in a calm, confident, loving space. And we have to welcome every new baby with love, to treat every mother in labor with love, respect, and part of decision-making, and to allow every father to participate in labor and birth in the way that they feel safe and comfortable, to add doulas to the circle of support, because doulas are there not only for the mother, but for the father and the partner. And we can do a lot to make, I believe, not only our births, but our communities and our society healthier.
I was on the tube with my mum the other day, and we were sitting near a baby in a buggy. The baby was all in pink. I noticed she was cooing up towards her mother, who was paying no attention to her. It was pretty easy to see that the baby was doing her best to get her mum's attention, but she was busy talking to her friend, never looking down once toward the baby, who was now pretty upset. I tried to make contact with the baby, but she only wanted her mum. As we pulled into the station, the women left the car.
Mind the gap.
With baby in tow.
Chapter 5. Attachment, bonding, and postpartum.
Thomas Verney.
Bonding refers to the relationship between the mother and the child. So bonding means that the mother has developed a loving, positive, caring relationship towards the child. Attachment is the same thing, but the arrow, so to speak, points from the baby to the mother. So the baby has developed positive feelings towards the mother. And the reason that this has been looked into now for many years is the fact that mothers who did not bond well with their children, for example, they were sick or the child was sick and was taken away from the mother because the child needed more care, whatever the case may be, if the bonding attachment does not occur properly, maximally, you have much more child abuse, much more abandonment of children. So the mothers don't care about their child as much because they have never really bonded. And in terms of the child, a lot of attachment disorders, as they are called, result in psychopathic personalities. People who have no conscience, people who can't love, who can't feel sympathy or empathy towards other people. And of course, you know what that can lead to. So the first few weeks and months of developing a loving relationship between the mother and the child are incredibly important for the future development of a human being. And by human, I really mean human in the best sense of the word.
Ina May Gaskin.
Now, what else about the ecstatic state? It's important because once the baby's born, we're not just trying to get the baby out of the woman's body. We want now the baby to remain with the mother in every case possible, place skin to skin and belly to belly with the mother. This prevents hemorrhage in the mother. It promotes good heart rhythm for the baby and good respiration also. It allows the baby to, clear its own breathing passages. And since it's not being held over on its back, the baby doesn't have to now be suctioned with a syringe or some such thing. Babies don't like that, okay? And yes, we're able to do that when necessary, but it's much better if you allow the baby, when possible, to do that for itself. You'll have a quicker time, generally, for the placenta to be born, and now the baby's going to find its way to the breast. Now you have a good relationship already started because the parents are not doubting the baby's survival abilities. They're often surprised to say, well, the baby actually found the breast on its own and latched on, and I didn't have to have a course in how it's done. And I go, yeah, your baby is actually as smart as a newborn hamster, rabbit, what have you. We don't think that all these other mammals have to go to courses to figure out how to nurture the baby, but only in our species do we routinely take the baby to another location. And then when we finally get them back together, guess what? They tend to have some problems because there is this state of ecstasy that both mother and baby can be in when the hormonal response is at its peak. And when you allow nature to take its course at the right time, things go much more easily.
Sandra Bardsley.
You know how most of the time you hear about the fight, flight, or freeze? Well, this would be a fourth element, and it involves the attachment issues. So, for instance, if you look at a baby, their eyes are so expressive, they're cooing at you to get your attention. If you don't give them attention, they start crying. That's our very first attachment issue. For instance, even as adults, if you think about it, when you walk into a room, you're sensing and feeling and listening and watching to see, am I safe in this environment? Is this a place that I'm going to be accepted? When a baby is first born, that's exactly what's happening to them. They're always trying to engage with their cooing, with their eyes, with their facial expression.
Therapist and author, Phyllis Klaus.
When the baby is well dried immediately and placed on the mother's chest, the mother's chest will warm up to just the right temperature to keep the baby warm. And even more than being wrapped in blankets or put in the cot, This is fascinating. And then the mother's chest has what's called a servo control. It's like a dial. It cools down if the baby's too warm to have just the right temperature for the baby. So it warms the baby and it can cool the baby. A father's chest or a partner's chest can warm the baby, but it doesn't have the servo control to cool the baby. So this is powerful to know. So now you need to dry the baby and put the dried baby on the breast. But that's powerful to know that this is probably life-saving of babies in times before people had blankets and anything else. The Swedish midwives, under the leadership of Dr. Kirsten Uvnes Moberg, who did all the work on oxytocin and so on, They also studied crying. And when your babies are placed in their mother's chests, they hardly cry at all, compared to a control group that were wrapped in a nice warm blanket and put in the bassinet.
Sandra.
We separate mother and baby right away. And we have all these baby carriers, and we have a nursery down the hallway, and we keep the baby, in essence, away from us, so to speak. Of course, we're carrying the baby to some extent, but we're not carrying the baby. If you study ancient wisdom and cultures around the world, carrying the baby, even in Bali, they have a beautiful ceremony at 6 to 9 months, in which the baby never touches the ground before then. And then they have a grounding ceremony. So there's a lot of things in our culture that we do. We take the baby away to weigh it. We take it away to get its footprint and its vitamin K shots and all these things.
Karen Melton.
So one of the cross-the-board things that I see all the time is isolation. Core isolation, I call it. It's core isolation imprinting. And it's the kind of isolation that I call it core because it's not just like, oh, I'm feeling a bit lonely. It's actually deep, deep in us on a very deep somatic, spiritual, energetic level. And it's almost like you can't really get to that unless you're working with the really early imprints and with what happened back then to that person. And the lucky ones are the ones that get help really early.
Phyllis Klaus.
This early period is pretty powerful. When the infant touches the mother's nipple in the first hour of life, that mother will decide to keep her baby. This is a time when, they had a choice to be rooming in or have the baby in the nursery. But the mother who had the baby right in that first hour, that baby was kept 100 minutes longer in her room every day during her hospital stay than another mother who didn't have that contact until later. So, to interrupt what is natural and normal is sad and doesn't have to happen. When mother has the baby starting from birth, rooming in, and increases the feedings from 5 to 6 a day to 9 to 11 a day, the milk comes in earlier, and within 2 weeks, the mothers produce 2/3 more volume of milk, had less sore nipples, breastfed longer, and much lower bilirubin. And this was studied by the Japanese that showed that if the baby suckles early, has 2 to 3 feedings and a stool within 5 hours after birth, large amounts of bilirubin are eliminated in the stool before they are absorbed into the gut, which is the substance where babies have to be under lights and they get sort of yellow looking from this bilirubin, which has to be eliminated. And when it's eliminated early, there's no problem with it. So all of this was meant to work. And instead of taking that baby right away and putting it in a nursery, it needs to be with its mother. So physiologically and emotionally, this is when the mothers start to look at this baby and take in the baby and feel this unbelievable love for the baby, and the partners become involved too. So we've got tremendous awareness now of the potential of this early period and to not interfere with it.
Debra Pascali-Bonaro.
Once that baby's born, I love to see fathers, if they can, really participating and present for that bonding, breastfeeding. And we know that fathers, that in the first day, and I like to often say in the first hour or two, can have skin-to-skin time. If they can just have 15 minutes of skin-to-skin time with their baby, they will spend an average of 50, that's 50 more minutes a day doing childcare and bonding with their baby going forward. So I think we do a disservice when we only talk about the mother getting this luscious skin-to-skin and bonding time. I think it's essential that mothers have it first, but after baby's been warmed and has breastfed, it's the perfect time for fathers to get their skin-to-skin bonding time too, and to really be there and kind of welcome this baby in for both of them in the way that feels right.
I'll tell you a little anecdote here. I was lecturing in California a couple of years ago, and a nurse told me that during her first pregnancy, her husband was a medical doctor. He was interning. He was hardly ever at home. So then the child was born. He made it to the hospital, and that was more or less his only contact with that child. 3 years later, she became pregnant again, but at that time, her husband had already finished his studies, and every night he was talking to the baby in utero. So I asked her, well, what would he say? And she said, well, he would talk about the weather and what a nice day it was, and now I hope you have a good sleep, and I love you. And so this continued all throughout the pregnancy. Then when the child was born, her husband was present, and he approached her and the baby after the baby was taken out and put on her chest. He sort of raised his hand and he said, "Hi, Jeffrey." And the woman said the baby just looked at him and smiled. And there was absolutely no doubt that this was a smile of recognition. And the interesting part of that story is, as she continued, that the relationship between that child and the father is so much better than the relationship between the first child and the father. And she was absolutely sure that that was due to prenatal communication and prenatal bonding. So one of the things that we have to realize is that because this child is already a thinking, feeling little human being, you can relate to it during your pregnancy. And so mothers and fathers and sisters and brothers can talk to the baby in utero and establish a relationship, and that will most likely, I mean, there are no 100% rules when it comes to human beings, but most likely it will increase the chances of positive postnatal bonding and establish a much better relationship between that child and his or her caretakers.
Phyllis Klaus.
You know, the postpartum period is extremely important. In other cultures, it's a protected time. It's a lying-in period that's been protected in India. They are really cared for in their own mother's home or their mother-in-law's home and nurtured for 6 months. And in China, it's called doing the month. And it's 6 weeks of getting the mother's body balanced again. And in Sweden, the mothers and fathers have 18 months of postpartum time that they can divide in however they wish. They don't lose their jobs. They get support. They're helped during this period. So, you know, we have really caused terrible problems in our culture. I was talking to a woman not too long ago, and she said, you know, I've been given 2 weeks off from my job after the baby is born. And I was, you know, a wreck. And I wasn't ready to go back. And other parents saying, well, you know, I had to go back to work. I put the baby in daycare at a month old. And I felt so bad to leave the baby. And children are being cheated out of this parent-loving time. So we have a big problem. Some women have said they were so tired and realized that they were short with the baby. They were almost annoyed with the baby. And the baby cried a lot, and they couldn't stop the baby crying, and they were set off in a very negative path. And they were almost glad when they had to go back to work and just, you know, get a babysitter. And this was very sad. And I began to think of the people, you know, I work with adults too, who would remember how unhappy they were and how they could pick up the stress that they caused their mother, and they felt it was their fault that the mother was unhappy, that the mother was angry, that the mother was depressed. Years later, they feel it, and they feel so bad that they're inadequate in some way. So this is a very big time. We need to honor this. Every single human being in this country has been born. They came into the world in the same way. And where is it that people have belittled this period and not valued it? It's unbelievable to me. We need things in place. We need support. If they can't have a parent or somebody to help them, we need people in the community that are trained to come in and be helpful. We have postpartum doulas. We have to have some support financially for this, who people cannot afford it. We got a long way to go, and it's very sad. And I see a great many women becoming anxious and becoming depressed. And if they've had a traumatic aspect to the birth, they have the trauma to work through. I am so pleased when women come to see me afterward because I can help them work this through emotionally and physiologically with the work I do. But not everybody can go to a therapist. Not everybody can find somebody to help them. So we've got a big problem. It's unsolved, and we need to address it in a large way.
Thank you for joining us for the beautiful work challenge on birth. And thanks to our Essence guests, Karen Melton, Thomas Vernay, Sandra Bardsley, Debra Pascali-Bonaro, Phyllis Claes, Robbie Davis-Floyd, and Ina May Gaskin. Appreciation to Wisdom Publications for permission to read from The Tibetan Art of Parenting by Annie Hubble and Eddie Farwell. And to HarperCollins Publishers Australia Proprietary Limited for the poem Mother to Child from Collected Poems 1942 to 1985 by Judith Wright. And thanks to Izzy Davies. Special thanks to everyone who subscribes to Catalista on Patreon, where contributors can access merch and bonus birth interviews. The Beautiful Work Challenge was edited by Tim Kirby, Gijsbert Bullshear, and Viren DeCan. Sound design is by Rich Cutler and Jay Blanchett, and mixing comes from Gijsbert and Mark Tulk. Our music is composed by George Jennings. The executive producers are Chicky Munch and Binny Bunny Munch, with assistance from Ed Goldberg, Nikki Hatzidis, and Gerald Gerbil. You can find the current schedule of Catalista podcasts and sign up for our weekly email at catalista.net. If you enjoyed the Beautiful Work Challenge, please add, comment, and like us on your favourite podcast platform. This is Fiona Watt, signing off from the temple at Catalista Centrale. See you next time for part 2 of On Birth, The Situation.